Heart attack is something like when the blood supply to a particular heart muscle territory is affected because the blood vessel supplying that particular muscle is affected by sudden occlusion. There is something like a plaque, cholesterol plaque, which gets ruptured, and once the cap ruptures, there is sudden attraction of the red blood cells, white blood cells, and platelets, and that causes a 30% or 50% blockade to 100% block, and then that suddenly results in heart muscle damage. That is called heart attack. So this heart attack sometimes causes electrical disturbance and can cause sudden cardiac arrest also. So they don't have time even to reach the hospital. So heart attack can cause either damage to the muscle, patients will have time to reach the hospital, or over a period of time they develop heart failure because enlargement and fall in the pumping function. And whereas sudden cardiac death is defined as the sudden circulatory collapse. So there is sudden absence of activity, pulseless, and that is within 1 hour of the onset of the symptoms, or a patient who is unwitnessed within the past 24 hours who was alive, and for no definite obvious cause like accidents and all, when we don't identify in the last 24 hours who was seen alive, if it happens, that is also termed as sudden cardiac death. So there are several causes of sudden cardiac death, one of which is coronary artery disease, that is a heart attack, either minor, it can be very minor heart attack, it can cause sudden cardiac death because of the electrical heterogeneous dispersion and then electrical accident. And other causes, almost 70-80% of the sudden cardiac arrest or sudden cardiac death is because of the coronary artery disease. And the other 20%, there are many other things like congenital heart disease, the channelopathies, likewise the valvular heart disease. So there are other causes also. So now coming to the heart failure. Heart failure can be because of coronary artery disease, where there is blood vessel blockade to the blood vessels, heart muscle damage, gradually enlarges and results in heart failure, where pressure in the heart is increased. There is back pressure built up in the lungs because heart is a motor. When it is weak, it cannot pull blood or water from the lungs. There is congestion, and then there is congestion if there is a right heart failure in the whole body, in the lower limb swelling and all. So heart failure is left heart failure or right heart failure, or both chambers fail. And coronary artery disease is one etiology for that, one cause. Other causes are without coronary artery disease, heart failure can occur with either simple muscle weakness due to either a viral infection or a bacterial infection, or sometimes anti-cancer drugs which we give, right? So likewise, alcohol. So all these things can cause what we call as a heart failure with normal coronaries or incidental coronary artery disease. So this heart failure sometimes can be diastolic heart failure, where the pumping function is normal, but still there is a stiffness of the heart muscle. So this is called as diastolic heart failure. That is a different issue. So now you have to identify, and the most important part to handle the sudden cardiac death or acute heart attack is handling it, diagnosing it, so without missing the diagnosis and treating it in the golden hour. That is the prime. If you treat this in the first 1 hour, almost 80%, more than 80% of the deaths which are happening every minute, every day, whatever are happening across the globe, are preventable deaths. Unfortunately, the systems, the knowledge, awareness for the patients, people, and also the treating physicians has to significantly improve to bring down the numbers and the mortality because of this sudden cardiac death.